Welcome back to another episode of Pelvic Confessions, where we open up honest conversations about all things women's health. I am Dr. Kari Hough, joined by my co-host and business partner, Dr. Jean Shirakabrad.
Every week, we talk about a pelvic health topic that women need to know, yet don't often talk about.
Yeah, we'll present these topics as confessions that women have told me in the clinic. And obviously, we'll omit names and details for the sake of privacy.
All right, you ready for this week's confession?
I am ready.
So you say. So you say. Alrighty. Today's confession. I have to cross my legs every time I sneeze because I worry I might pee myself. Now, I'll be honest with you, Kari. I am probably like most women and some men, I am thoroughly confused by the variety of issues that are in the realm of peeing.
Yeah.
This one is a common one.
Yes.
What is this issue pertaining to?
Yeah. So it sounds like this issue would likely be classified as what is called stress incontinence.
Okay.
When we're talking about leaking, there are several different types of leaking. And so first and foremost, women generally know if they're having urine come out of them that is uncontrollable, that there might be something wrong. I think it's become very normalized. But from a clinical standpoint, when a woman comes into me and they're expressing that they have uncontrolled urine loss, it's important to know what kind of urine loss is going on.
Yeah, definitely. And this is something I hope you can clarify for me as well, because obviously I've learned this. This is not my specialty of practice. And like I said, I'll be honest, I get confused by this or mix them up all the time. In my world, what I commonly hear is like if we're going to do jump rope before working out, and women are like, wait, I have to go to the bathroom. They do this preventive measure. Is this the same realm that we're talking about?
Most likely it could be. Now there could be a sense of urgency with that,
Yes, which is a different issue.
Right there. So there's the main categories of urinary incontinence is urine leakage. That's the medical terminology for it, is incontinence. There's urge incontinence, which is associated with that feeling of I gotta go right now, and if I don't get there and zip my pants down quick enough, it's going to be a mess, right? So that's urge incontinence.
Okay.
What you're talking about, and I think would likely more fall under the category of, would be stress incontinence, which has to do more with pressure and impact. So oftentimes stress incontinence, things that might be categorized under that would be leaking with jumping or sneezing or coughing, picking up, running, jump rope for our athletes. Anything that is indicative of there's some type of pressure built up inside, and that is the moment when you have urine loss.
Yep. So let's talk about that pressure, because that's very important.
Yep.
Pressure, let's first define it. Pressure doesn't necessarily mean like physical tissue pressure. It's air pressure.
It's intra-abdominal pressure.
Right.
So it's pressure that gets trapped inside your abdominal cavity. And there's studies to support that just coughing puts 35 pounds of pressure on your pelvic floor muscles.
Wow.
So yeah, when we're talking about pressure, we're talking about air inside of our abdomen. And with stress incontinence, what happens is that gets built up in here. It pushes down on your bladder. Those pelvic muscles are supposed to push up against that. But when they can't fight that pressure overcomes it. That's when we have urine loss.
And managing pressure is obviously important. I'm sure we'll touch on that in terms of a treatment approach. But that gradation, I'm guessing the forcefulness of the pressure is what will ultimately cause the leakage to come out, right? If you sneeze, that's a very forceful movement or jumping.
Sure.
So
it's generated from that force, but your pelvic floor muscles are supposed to withstand the force. So it's kind of balance of both. We're likely not going to be able to decrease the force of coughing or some of those activities. Now, there are things we can do to help mitigate it a little, but those pelvic muscles should have the strength to be able to overcome that.
Right. And that's kind of where I was headed at, is like if you're going to sneeze, you're not necessarily going to control your sneeze, but so control the things you can actually control. And I think this is where pelvic physical therapy can probably play a role in that
training those muscles, right?
Yeah.
So Again, there's a big notion when we're having leaking that women think that that must mean my muscles are weak.
Yeah.
That's not always the
Hmm.
case. If you remember from the conversation we had about that bicep analogy of that
Yes.
muscle either being kind of tight or weak, it's like a spectrum. Your
Yeah.
pelvic floor muscles are on the spectrum of low tone, very poor weakness, can't generate activity, or the opposite end of that spectrum is they're very high tone and they're caught in this kind of contracted state. And so when I would get a woman in for this issue, this client specifically, one of our first assessments is where are your pelvic muscles? Because that treatment looks very different. I can't treat somebody who has weak muscles the same as I would with somebody who their muscle is weak because they're really in this overactive state.
Yeah. Well, first of all, nice job getting your bicep flexing in there again.
Anytime,
Yeah.
anytime.
It
Yep.
was very natural this time. So let's touch on that treatment approach because I'm sure women that are listening to this that do jump rope, that do this preventive measure. First of all, I'm always curious: is there a potential hindrance by preventing or going to the bathroom beforehand because you're worried about leaking, or is there a better approach?
That's where some of that might be a learned behavior.
Uh-huh.
Some of that could be an urgency. Like there could certainly be an exacerbation of the leaking. If there is urgency,
Yeah.
again, I'd
What
probably
if, so let me clarify. What if they don't feel like they have to, but they do it anyway because they think that the
right,
stress will
right.
cause it?
They're going just in case.
Correct.
And we typically want to avoid that in instances when we can. But I don't blame them because they're wanting to go partake in
Sure.
their exercise class and they're trying to do anything they can to get last few dribbles out of their bladder.
Yeah.
But that's a big part of some of the treatment strategies that we discuss and talk about with these
So
females.
let's touch on some of the treatment
Yeah.
strategies. What is an approach for
Yeah.
stress incontinence?
Well, it depends again if we go back to that spectrum of where the muscles are.
Hmm.
Are they on this lower end of weak, poor muscle, just even hypertrophy of
Hmm.
the pelvic floor? That's going to look like a lot of strength and endurance work and power work. If they're more on the end of that overactivity, that's going to look like down regulation and getting those muscles to release that tension. And then usually with both of those cases, there's a huge coordination and a timing piece because those pelvic floor muscles should meet that demand of that pressure and they're not. So there's this almost delayed onset of those muscles. And so it's a big timing coordination piece that we'll work on in session as well.
So I'm going to ask you a tough question. I know you're going to want to answer it. It depends,
Okay.
but you're not allowed. So timing wise, not just timing of the muscles activating, a typical course of treatment for let's say both if somebody is super active to
Hmm.
downregulate them, and on the other side, if somebody's weak to build that musculature up, what are typical time frames for that?
It
I
depends.
know you're
No,
not
okay.
allowed.
But this stuff can take time. We have to remember that those pelvic muscles are musculoskeletal, right? So even the same way you would train a muscle starting off in the gym, if I have somebody who is low tone and I need to build up those muscles,
Hmm.
we know that the first 4 to 6 weeks of working out is even just neural, the brain connecting to those muscles.
Right,
And then it's after that that the strength gains can come.
right.
And so this is a process that can sometimes take months, not to sugarcoat it. Now, certainly you have people on each end of the curve
Sure.
of maybe it takes a couple sessions. Maybe it's something super simple with just their technique or just their timing. Maybe
Hmm.
they have appropriate tone and good coordination and we can resolve that a little bit sooner. And I've definitely seen that. But I think something realistic could probably be somewhere in the 3 month ballpark.
Okay, and I'm guessing it's not all or nothing, right? Throughout those 3 months, you see some ups, some downs, some
Absolutely. Yeah.
progression as that's happening. Well, that's great. I think it helps me clarify. I'm sure we'll touch on the other types of incontinence in
Sure.
future episodes. But the stress incontinence, something that I hear about a lot, and I know it happens often,
Yes.
just in my experience, and
Yeah.
obviously in yours as well.
And I want women to know the big takeaway again. Urine loss is one of the more well-known women's health issues. We can recognize when we're losing urine outside of our body, something maybe isn't right. But I think women fall into this narrative that my mom had leaking or I've had three
Mm,
children and I should have leaking. But there are conservative measures that there's physical therapy, there's exercises that we can do that are non-invasive, that don't require medication, that don't require surgery to help resolve some of those
yeah.
urine losses.
So even if somebody's been having this for years or decades, or they've seen their family members, it still could be dealt with in a few months if it's consistent.
Yeah, I've treated women 20 years post-birth who have had this leaking since delivery of their child, and we're making improvements to their urine loss, both at home and in the gym.
That's awesome. Well, I hope that gives you some hope. And if you're dealing with an issue like this, obviously doing mitigating things like going to the bathroom and things like that can be a band-aid on a bigger issue. So that there is a solution potentially for you if you're dealing with stress incontinence and such issues. And if we can help you out, head over to Restore Pelvic Physical Therapy if you're in the Howard County or general Maryland area. If not, seek out a pelvic physical therapist to help you out. And for Dr. Kari, I'm Dr. Gene Shirakabrad at Restore Pelvic Physical Therapy. Thanks for tuning in.
Thank you.
Cheers.
Cheers. Mm.
It doesn't taste super strong.
What
I don't think it's
what
an
color
intense
does it
though.
taste like?
It tastes like a green.